Dr. T, I want to talk about tendonitis. Tendonitis is inflammation of those structures that attach the muscle to the bone, enabling the muscle to act on the bone and to produce either stability or motion. Understand a tendon such as the Achilles tendon, most notable tendon everybody is aware of. There are other tendons in the foot which may manifest an injury, and that injury is the little fibers within the tendon can become inflamed and pull apart. That inflammation doesn't heal very well without immobilization and rest. The reason being, tendons do not have the best vascular supply. They receive their vascular supply from the muscle, and when the tendon is injured, that vascular supply can be compromised by the swelling and inflammation that ensues from that injury. Many people develop injuries from activities, sometimes overuse and fatigue. Dehydration is one of the most common causes of tendonitis, as well as improper shoe wear. To treat yourself is be very aware that you choose a shoe wear that is appropriate for the activity. If the pain persists, it's good to have treatment as soon as possible, because acute tendonitis is easy to heal using common non-steroidals over the counter, such as Aleve or Naproxen or Advil. Many times that will help, along with ice and immobilization and decreased activity, obviously. I want my patients to understand, though, these tendons, you can kind of self-diagnose an injury. Achilles tendon will hurt when you try to push off. You'll have pain in the Achilles tendon or in the back of the heel. You may feel a swelling or inflammation there. Going up or downstairs, you may have inflammation in the anterior tib tendon, which is in the front of the foot. You'll see a collapse of the arch or weakness in the arch with pain in the arch area. If the posterior tib tendon, which is the tendon that supports the arch in of itself, you may even see a collapse in that arch when you have inflammation of that tendon. Sometimes a fracture or an injury in the midfoot, the bones in the midfoot, which are these bones that support the arch, sometimes with an injury there, you will get a reflex spasm of the tendons, and that spasm will cause fatigue and injury as well. It's very important that it be diagnosed. If it becomes a chronic problem, anything over 10 days, 2 weeks that continues to bother you, you should see a doctor, because you may need x-rays to determine whether or not there's a fracture, or an MRI to determine if there is soft tissue injury to those ligaments or tendons that are causing the inflammation. If you have any other questions, feel free to call me or contact me at the office.